Mango has been around since 2011 and has really been the top tier, best-in-class solution for medication management and adherence. What we're very excited about at TrialCard is being able to supplement our affordability programs as well as our hub and specialty programs with Mango Health. On the copay side, where this is really going to benefit patients and our clients, is through increased adherence. And on the specialty side, we know that there's a lot that's left to be desired on the patient experience, and Mango is going to really improve that.
I think the opportunity for patients to have a better overall medication experience is significant, and we're excited to see how we can transform patient experiences.
This is really a step change in how we support patients and pharmaceutical brands. For patients, it's about bringing together a broad array of support solutions that previously were siloed, so access, affordability, adherence, and engagement, and delivering that support to patients where they spend their time, which is on their mobile devices. And for pharma, this is really about meeting patients where they are, engaging them on their platform of choice, and driving a substantially different outcome, both in terms of medication adherence and fills, but also in terms of insight across the patient journey. Mobile technology is critical to helping patients. The average American now spends 5 hours a day on their mobile device. If you want to be relevant to people, if you want to support people, you have to be present on that device. And if you can create an experience that is valuable and seamless on the mobile device for patients, then you earn the right to be there every single day, and that gives you two main advantages. One is it gives you insight into what's happening with patients every single day across the patient journey. And two, with that insight, you can then engage and influence patients for better outcomes.
When I think about Amazon and Uber today, one of the things that strikes me the most about their services and the experiences that they're creating for their consumers is they're creating transparency. They're allowing their customers insight into the purchasing process, the delivery process. And I think when I think about medication program management programs today, I think there's such a huge opportunity to integrate the patient more into that experience so that they can have transparency and see what's happening with their medication when it's ordered, or when a case status has changed in the hub program that they're enrolled in. This type of transparency generates trust, and it makes patients want to engage.
So let's just start with some definitions. So primary non-adherence is patients that receive a prescription but never pick it up. And secondary non-adherence are patients that have filled their first prescription but then don't stay on therapy or don't take their medication the right way afterwards. And the industry often focuses on secondary non-adherence, but primary non-adherence is a huge issue. On average, something like 30% of medications are never even filled. And this creates a host of downstream issues for patients, payers, providers, the whole ecosystem. And it's a tricky problem. Primary non-adherence can be related to whether patients can afford the medication, whether patients believe that the medication is good for them and right for them, and whether they can just go and find and get their medications conveniently. So to move the needle on primary non-adherence, you really have to engage patients very quickly and early after that prescription has been written, and you have to try to identify the issues or the barriers that that individual patient has which would otherwise cause them not to go get their medication. And then try to engage that patient, educate them, have a conversation to try to get them to that first fill.